So, Izzabella, what did you come in for?
At the beginning, I wasn't sure what I came in for. I knew that I had a limitation in my left arm. I couldn't move my left arm. I had extreme pain and numbness in my fingers and the tingling in my fingers. And I think I wasn't really sure what sort of a treatment would be applied because I assumed I had nerve damage. And but I thought, well, let me try, and maybe there was something else that I don't know about. So when I came, I was actually diagnosed with the frozen shoulder syndrome, which I thought, oh, really? I thought it was something even more serious, but it still was very difficult to take on a daily basis with the very limited range movement that I experienced.
And how long had you been experiencing the symptoms?
For a few months, let me see, I think if I recall 4 months, maybe 5 months. I would say between 4 or 5, somewhere around that. I almost lost track of it since it started with a smaller pain, less pain, which is growing and developing into quite restricting arm movement.
Okay. And had you had any previous treatments of any kind?
No, not for the arm. It was always perfect, and I could do everything with my left arm exactly as I could do with my right arm.
Okay. And when you first came in, how much pain were you feeling on a scale of 0 to 10? 0 being no pain and 10 being emergency
I would say between 9 and almost 9.5. It was very bad.
Okay. And how much are you feeling right now?
It's amazing. I'm really impressed, I have to say that, with right now I think it's the 4th week, and we had so far 2 treatments a week, that the improvement would be so fast. It just, I think it changes my life slowly. It just puts it back on the track. I'm thinking, hey, I can actually move my arm much more than I could before. And it's again, also there was no numbness, no tingliness in my fingers. So I really see that it is getting better. Also, another thing is sleeping. It's not as difficult as it was before. Somehow I always had to remember not to move my left arm, or to be very careful with my left arm movement, or not to sleep on the left side. It was the left side was always on my mind. So it is actually less preoccupation with it right now.
That's wonderful. And how many ASTR treatments did you have before you started noticing relief?
I would say probably with the 2nd week. So I would say maybe with the 3rd treatment. Each time I would see, I would feel a little more relief. But I probably the most noticeable would be within the maybe 3rd or the 4th treatments. I would say the 2nd week.
Wonderful. And what do you think about ASTR?
I don't really know what I think about the name itself, but whatever it means, it helps me. And it helps my arm. It relieves the pain.
Wonderful. Thank you, Izzabella.
Thank you.